Dr. Kahan, let's talk about ingrown toenails. Seems to be a relatively big issue with many of us. And tell us a little bit about the potential which, we might be doing wrong by the way we cut them. On the other hand, we all know to cut them straight, but still, they're growing in. Anyway, tell us about ingrown toenail and the advances which have been made in fixing it.
Absolutely. Love ingrown toenails. We're talking about a condition that...
You love ingrown toenails, huh?
Oh, I love them. I love seeing ingrown toenails for one reason. You come into my office with an ingrown toenail, 2 hours later, you forgot about it because your toes is 100% back to normal most of the time.
Isn't that the reason you became a podiatrist? Wasn't that I remember you telling me that you had when you had sports, the ingrown toenail started hurting you, the doctor fixed you, and that kind of kept hanging in your head, and thus you became a doctor, podiatrist.
Absolutely. When you can fix a problem that is that painful and that debilitating and prevent you from, you don't even want to put your shoes on or walk around. You take care of it and boom, like that, you're right back to doing whatever you want to do in an hour or 2 hours. It's a beautiful thing. Ingrown toenails, though, you did mention, proper trimming and cutting. Most patients know I need to trim my toenails straight across. All right, that's fine. But guess what? They forgot to tell their kids that because there's a lot of kids that have ingrown toenails. We see a tremendous number of kids, and they think they can correct the problem themselves, and they start to dig down into the corners of their nail, and the next thing they know, they've got a big swollen toe. It hurts, and they forget to tell anybody, and mom or dad looks down at it 3-4 months later. Anyway, ingrown toenails, they're very simple to treat. They're simple to avoid basically by letting the nails grow beyond the edges of the skin. If the nail is grown beyond the edge of the skin, you're probably not going to have a problem unless you get stepped on by another person or a horse or some kind of trauma that may cause the ingrown toenail. Very easy to fix.
Your socks that way. Your socks get holes in it that way.
Well, then I do have a sock replacement program I'm going to start instituting.
All right. So how do you fix it? How do you can get rid of an ingrown toenail very fast? What's the procedure there?
Procedure, very simple. Patient comes in and with just a small amount of local anesthetic put into the toe. We can fix an ingrown toenail one of two ways. If a patient's had a recurrent ingrown nail, it keeps coming and coming, I strongly recommend that they do a permanent correction of the corner of the nail. We can take out a very slight, if somebody picks up a ruler and I say 1 millimeter or a 16th of an inch, we're talking about a very thin piece of nail that can be removed from the nail. The problem is resolved 100%, and I guarantee that nail will never, ever be a problem for them ever again. So ingrown nail, big problem,
even if
a lot of pain.
Cutting it wrong, sorry to interrupt you, but it will not be a problem even if they do not cut it correctly?
If I fix it permanently, they can cut it any way they want because it will never grow into that corner again. It's absolutely impossible. Once I take the corner of the nail out, it cannot grow into the corner again. They can do anything they want to it. It will likely never grow back. If I don't correct it permanently, yes, I can fix the ingrown nail. We can clear up the infection. 6, 7, 8 months later, that ingrown nail can come right back. Absolutely. That I have no control over. I can fix it permanently and guarantee you it won't come back, or I can fix it and clear up the infection, but I can't guarantee that problem may not come back. Most of the time, it's caused by trauma or improper shoe gear. So we can fix them, and they're not going to be a problem. There's a family history is also big. I'll have kids that come in, and it's on both big toes, and they'll say, oh, yeah, my dad gets these all the time. So, that's a tough situation. That's where I strongly recommend, get them fixed, make it permanent. You won't have to deal with this ever again.
Right. So I guess it's a little bit of history. I mean, it depends on how it came about. Sometimes things just come about, you fix them, and it's fine. It's not an ongoing problem. And if for some reason the situation, whether that is the way the person cuts his toes and just doesn't want to change, or for some reason the way he's built or his toes are built, you'll be then able to judge and say, look, I think in your case a one-time fix is fine, or let's do it the permanent way, and get the agreement with the patient on it. Wonderful. So it can be fixed. Is it painful to fix it?
I'm going to say no. The most painful aspect of it is having the toe put to sleep with a local anesthetic. And the easiest analogy, and most people have gone in to have blood taken out of their arm. That's basically what it feels like. It's a quick poke, a little bit of burn, but for the most part, we have even advanced in the technology of how to give an injection nearly pain-free. It's pretty neat. It's good stuff. So very minimal pain at all.
Beautiful. And when a patient walks out of your office, can he walk out, or does he have to be carried out on a stretcher? And can he go to work again? What's the deal there?
They walk out, they put their shoes on, it's not a problem. We're done with the procedure. The foot goes inside their shoe. The next day, they have some instructions on what to do. 99% of the time tomorrow, they can go kick soccer balls.
Great.
No downtime. Very, very minimal downtime.
Well, great. And so since they can play soccer the next day, it doesn't look like you charged them an arm and a leg and had to amputate that one leg for payment. You didn't. It's not that expensive either.
It's not that expensive. We try to be very nice. We try to be very reasonable. And, I offer the guarantee of the ingrown nail removal because I know how painful that can be. And if they're coming to see me for that, if I can't fix it the first time correctly, then I shouldn't be doing what I'm doing. That's the bottom line.
Well, anyway, very interesting to know that this is actually a problem. We don't need to tinker with it at home for sometimes years to kind of in and out and, and et cetera, and little pain. But we don't want to be sissy and go to the doctor. It's like go there, get it fixed, and it's over with. Thank you.
Correct. And let me throw in one last part about ingrown toenails. A lot of times we'll have patients that come in, they've gone to see their primary care doctor because they're not sure what to do, and the doctor gives them an antibiotic. They take it for 7 days, 10 days, 14 days, and guess what? The problem is still there. It would be kind of like running over a nail. You got a nail in your tire, you put a Band-Aid over it. Guess what? You still have a flat tire. The problem has to be fixed.
Right. Obviously. It is sticking in there. It is growing in there. It is keeping growing in there. And just masking the pain and the infection that just, I can see that. Thank you very much.
Exactly.